Okay, good morning students. Now we are going to learn the second video for the labeling, and in the second video, first thing that we are having here, that is the wrist. Here we can see the transverse section and the carpal bones. We can see the tendon. So let's see that what structures we can see here. First of all, we are having the carpal bones, and we'll not talk about them. We see that here the tendon, that is the palmaris longus tendon. We got here the ulnar artery, and we are having the ulnar nerve, and after that flexor retinaculum here, and inside the flexor retinaculum we are having the flexor carpi radialis tendon here, and under that we are having the flexor pollicis longus, and the nerve, very important, under the flexor retinaculum, that is a median nerve. When it compressed, then we are having the carpal tunnel syndrome. The upper four tendons are representing the flexor digitorum superficialis, and the lower four tendon are representing the flexor digitorum profundus tendon. Now let's come to the thumb side. Here we are having the, first of all, abductor pollicis longus tendon. We got here the extensor pollicis brevis tendon, and then we got here the extensor pollicis longus tendon here. So this is the point that where we are having the snuff box. Here we got the content as the radial artery, and we got here the cephalic vein. Now we are having here the extensor carpi radialis longus tendon and the brevis together here. The longest one is the lateral side and the brevis one is the medial side. We got here the four tendon continuously here. They are representing the extensor digitorum tendon, except that in front of this there is a small tendon that is representing the extensor indicis tendon. We got here the extensor digiti minimi tendon here, and we got here the extensor carpi ulnaris tendon, and here we got the basilic vein. So thank you. Let's go to the next portion here. That is the to represent the breast from the sagittal view. So we got here, first of all, the nipple. Around the nipple, the area, we call that areola. We got here the lactiferous ducts, and we got here the lactiferous what we call that sinuses, and we got here the mammary glands, and after that we are having the deep fascia, and under the deep fascia we got here the pectoralis major muscle. Above that we have the pectoralis minor. We got here the ribs, and in the ribs here we are having the muscles. We call that the external, internal, the innermost intercostal, and in some pictures may they also show the ligaments here. We call them Cooper ligaments, okay, or suspensory ligaments. So pay attention on this picture also for the labeling. Downside there is also showing that is the external oblique muscle from the abdomen portion. Let's go to the next picture. This is a section and showing that from the inferior to the superior view. So first of all we got here the sternum, backside the vertebra, okay. So this side, on the left side, left lung side, that we can see here the aorta is giving the branch, okay, what we call that the intercostal artery. This intercostal artery is giving the posterior intercostal artery here, and at this place the lateral cutaneous branch of that, and anteriorly we can see the small artery, that round one, that is the internal thoracic artery, also known as the internal mammary artery, which one is giving the anterior perforating branch here. Now let's come to the this side, that we got here inside the vertebra, that is a spinal cord here, okay. From the spinal cord we are having the spinal nerve, which one is giving the posterior ramus and the anterior ramus. This anterior ramus is giving the laterally the cutaneous branch, and then carrying on anteriorly, that is the anterior cutaneous branch. So almost the 10 things you need to remember from here. That it may also ask about the muscle. So the back side is mainly showing the erector muscle, and in the wall it is showing the external portion, that the external intercostal, internal intercostal, and the innermost respectively. Now we come to the next picture. The next picture is showing the same thing that from the most outer the skin and right under the skin we are having the superficial fascia, and under the superficial fascia we got here the muscle that is attaching to the rib, that is the serratus anterior muscle. After that, inside in between the two ribs we are having the external intercostal, and after that we can see here that is the internal intercostal, and after that the innermost. And after that the yellow colored line is representing the fascia that is endothelial, or we can see endothoracic fascia. And after that fascia we are having the layers of the pleura, what we call that parietal and the visceral, and then the lung portion or lung tissue you can say. Then we got here the rib, and under the rib we are having the costal groove, and at the groove we are having the structures, what we call that the intercostal vein, artery and nerve respectively, and downside here we are having the collateral branches of that. Under the costal groove we can see the intercostal vein, artery and the nerve, and downside we are having here the collateral branches of that. Now let's go to the next picture. The next picture is the section, transverse section at the T3 level approximately, and at this place that what we can see, and that we can see the vertebra T3, we can see the lung and the pleura, two layers, we can see the lymphatic ducts, we can see the esophagus, we can see the trachea, we can see the left subclavian artery, left common carotid and brachiocephalic artery, and we can see the left and right brachiocephalic veins here, and thymus we can see here, we can see here the sternum and the both side of the brachiocephalic vein, that we can see here the phrenic nerve respectively, left and right, and then we got here the left and the right vagus nerve respectively here, and in between the esophagus and the trachea at this place on this side that we are having the left recurrent laryngeal nerve. So thank you very much, see you in the next video.